I am so honored to be here with African Parks. I'm probably going to salt in a few stories as I talk about why I'm so excited about this partnership. I'm a medical doctor and I've worked in the US and I've worked internationally, but I began my career in Africa. I raised my children in Africa. And when we lived in Nairobi, every Sunday afternoon, we took them out to the game park and we went regularly thereafter. When my older daughter was about 2.5, we went to a little sanctuary area with the rare white elephants in Nairobi, and they were guarded 24 hours a day. And so they were tame enough. So I have this picture of my little tiny daughter holding the tail of a white rhino. And 3 months later, they were all killed, from the moms to the babies. In my career, I have seen health of women and children in Africa improve enormously. I have seen those same game parks that I used to bring my children to be completely decimated. So I'm so excited to be partnering with African Parks, so excited that there is a conservation organization who realized that the people who live around the parks both need and deserve the care, but it's also to the benefit of the animals and the wildlife conservation. So we're going to be partnering in exactly those parks that you saw. I've had the honor now of going to 4 of the parks, 2 of the ones in Malawi and another one in Central African Republic and in Congo. And what we hope to do is embed ourselves within the African park structure and then work with the clinics and the communities that surround the parks so that we can bring better health. Americares, as you've heard today, thinks that health is at the center, but it's at the center because healthy people can be economically productive, their kids can go to school and learn, and by doing that, then we take some of the population pressure off of the parks. We build the opportunity for them to see that this partnership is what's enabling them to have good health, and therefore we will be able to protect the animals and have corridors of health for the people as well. So we're starting right now. We've just hired 2 project managers from Malawi who have already done assessments. We're going to be doing things like rebuilding some of the infrastructure, doing training on how to take care of their medicines and medical supplies, get safe water into those clinics, and then build some of the capacity. So in Malawi, we'll be working in 4 communities and clinics right away. One of the other things I'm also really, really excited about, and that is if you looked at the map that Peter showed you, they're working in some very insecure areas. Those insecure areas have been devastated from the animal perspective, but they've also been devastated from the people perspective. And when I think about the countries that have the worst health indicators in the world, Central African Republic is right up there. Republic of Congo are right up there. But it's so insecure that it's hard for an organization like us to go in and work in these areas. But working with African Parks, who have protected the perimeter of the park for the sake of the animals, allows us to bring our people in and work there and reach out to those communities, do training for those communities, do mobile medical for those communities. So I can envision working in Central African Republic and the Republic of Congo, places I never thought we would be able to get to, only because we have this really vibrant relationship with African Parks. So we're really excited. This is the great launch, and watch what happens. It's going to be amazing. Thank you.